हेलो एवरीवन, मैं डॉक्टर दिशा आपका फिर से स्वागत करती हूँ आज के इस वेबिनार में। सो टुडे वी आर टेकिंग अप अ वेरी इंपॉर्टेंट टॉपिक, सर्वाइकल एंड लंबर स्पॉन्डिलाइटिस। मैक्सिमम लोगों को आजकल गर्दन के दर्द का या कमर के दर्द का प्रॉब्लम हो जाता है, स्लिप डिस्क जिसको कहते हैं। आजकल यंगस्टर्स में भी ये, या आई वुड से अराउंड 30-35 वाली एज वालों में ये ज्यादा देखने को मिल रहा है, क्योंकि लगातार कान पे मोबाइल रख के इस तरह से बात करना या कॉन्स्टेंटली एक ही पोजीशन में बैठे रहना, लॉन्ग ऑफिस आवर्स। बीइंग इन मुंबई आई कैन से कि मुंबई में रहने वालों को तो रोड्स की भी हालत पता ही है, तो जो जर्क्स लगते हैं उसकी वजह से कमर में दर्द होना, स्पेशली इफ यू आर ऑन टू व्हीलर्स। तो ये सब की वजह से क्या क्या तकलीफें होती है, इन सब के क्या प्रिकॉशंस लेने चाहिए, इन सबको कैसे अवॉइड करना चाहिए इफ यू हैव नॉट गॉट इट, और अगर है तो इसका डायग्नोसिस क्या, कैसे, कब जाके डॉक्टर को दिखाना है, क्या क्या करना चाहिए, इन सब के बारे में आज हमें जानकारी देने के लिए हमारे साथ जुड़े हैं डॉक्टर चिंतन जड़िया। ही इज अ MS ऑर्थो and he is an associate professor at Sion Hospital. He is also consulting at in Mumbai at Hitwardhak Hospital, Nama Hospital, and Tunga Hospital in Malad. Also at Matoshri Gomti Hospital in Goregaon. So without wasting much time and getting to know more, let's start with the session. And I give it over to Chintan Jadia. So Dr. Chintan, welcome to our webinar.
Thank you.
And
Thank you very much.
let's start with you.
Thank you. Hello and good morning to everyone.
Can we have the volume a bit higher on your side?
Is it okay now?
Yeah,
Am I
a
audible?
little slow, but it's fine.
Okay. So, hello and good morning, everyone. I am Dr. Chintan Jadia, and Disha ji ने बहुत correctly एक चीज बताई that spondylosis या spondylitis can be used interchangeably. बहुत common problem है in the current age, given our lifestyle, the aging process, the stress in our life and everything. एक orthopedic OPD में अगर हम 10 पेशेंट्स देखते हैं तो आई कैन से फ्रॉम माय एक्सपीरियंस ऑफ अराउंड 9 years in orthopedics that 7 patients will invariably have either a neck pain or back pain, और इसलिए ये सबसे कॉमन ऑर्थोपेडिक प्रॉब्लम कहा जाता है. So today we are here to just see what exactly is spondylosis. मेरे एक्सपीरियंस में पेशेंट्स को इसके बारे में पूरी जानकारी नहीं होती है, काफी गुमराह होते हैं पेशेंट्स बिकॉज ऑफ दिस कंडीशन, एंड माय पर्पस हियर इज टू ट्राई एंड सॉल्व द मिथ्स एंड मिस्ट्रीज अराउंड स्पॉन्डिलोसिस. सो विद दैट आई विल बी शेयरिंग माय स्क्रीन. Okay, is my screen visible?
Yeah, it is visible, and if you can still put up your volume a bit more, because it is very.
Oh, okay. My volume is at its maximum. Can you now hear me?
Now it's fine.
Yeah. Okay. So let's talk about spondylosis. Sorry, I think. Is my screen still visible?
No.
Okay, one second. Yeah. Right. So let's talk about spondylosis. आज के टॉपिक में आई वुड लाइक टू कवर कुछ important points ताकि the whole topic of spondylosis is cleared. The aim will be to try and make it as simple आप लोगों के समझने के लिए. At any given point of time, if audience have any questions, you all can put it up on the chat box and I'll be more than happy to answer. I will be starting off with the anatomy, मतलब हमारे spine का structure कैसे होता है, very simply, just ताकि आपको समझ में आए कि spondylosis में क्या होता है. Next, I will be moving on to what is spondylosis. किस चीज से हमें spondylosis हो सकता है, what are the risk factors. जब आपको ये डिजीज होती है तो what are the signs and symptoms, डॉक्टर्स कैसे डायग्नोज करते हैं और फाइनली क्या मैनेज और कैसे मैनेज कर सकते हैं, and what advices do we give patient. So moving on to the anatomy, अगर हम हमारी spine देखें तो it is like a stack of coins. अगर हम सिक्कों को एक के ऊपर एक रखते हैं तो कैसे एक पूरा पिलर बन जाता है, very similarly bones एक के ऊपर एक ऐसे स्टॉक किए जाते हैं to make our entire spine, which is divided into 4 parts. The cervical spine, जो ऊपर की 7 हड्डियां होती है उसको cervical spine बोलते हैं. उसके नीचे की 12 हड्डियों को thoracic spine बोलते हैं. उसके नीचे की 5 हड्डियों को lumbar spine बोलते हैं. फिर sacrum और tailbone. वैसे करके हमारी पूरी spine बनती है और ये हड्डियों के बीचों बीच हमारा स्पाइनल कॉर्ड पास होता है जो हमारे ब्रेन्स के सिग्नल को हमारे हाथ और पैरों को पहुंचाता है. दैट इज व्हाट कंट्रोल्स हमारी मूवमेंट्स ऑफ द हैंड्स एंड द लेग्स. ये समझना बहुत जरूरी है क्योंकि कोई भी स्पॉन्डाइलोसिस का प्रॉब्लम जब होता है तो वो सिर्फ बैक पेन से रिलेटेड नहीं होता है. दे ऑल्सो अफेक्ट अवर नर्व्स जो स्पाइनल कॉर्ड से निकलती है, एंड इन एडवांस स्टेजेस स्पाइनल कॉर्ड को भी अफेक्ट हो सकता है. That is why it is very important to know this. हर एक लेवल से, जो स्पाइन का हर एक लेवल है उसमें से नर्व्स निकलती है, नसें निकलती है, which control very very specific movements. जैसे just for example, अगर हम C7 की बात करें जो आपके लेफ्ट साइड के डायग्राम में है, तो हमारे ट्राइसेप्स या हमारे हाथ के जो अपर मसल है उसको कंट्रोल करती है. So this is important to know because हर एक नस बहुत स्पेसिफिक काम करती है हमारी बॉडी में और ये हमें अक्सर डायग्नोसिस में मदद कर सकती है विदाउट एनी एडवांस्ड डायग्नोस्टिक स्कैन्स लाइक एन MRI. जस्ट इसका नॉलेज होने पर भी हमें बहुत सिग्निफिकेंट इंफॉर्मेशन मिल सकती है पेशेंट से, राइट. अगर हम एक सिंगल हड्डी, एक सिंगल वर्टेब्रे की बात करें तो उसकी मेन बॉडी रहती है जिसके ऊपर और नीचे डिस्क स्पेस होती है. सेंटर में जो उसका ये रहता है, there is a small hole in the center through which the spinal cord passes, and there are joints above and below, and these joints and the disc that is there in between the body is very important to understand the process of spondylosis. जैसे कि मैंने बताया, they are stacked one over the other, and in between we have the discs which act as the cushion of the spine. So spondylosis exactly क्या होता है, what exactly is spondylosis? Personally जब patients मेरे पास आते हैं तो I say ये बीमारी नहीं है, this is not a disease, ये aging है, this is age of our body. जैसे बहुत सारी कॉमन चीजें होती है, चेंजेस होते हैं रादर हमारे बॉडी में व्हेन वी एज. फॉर एग्जांपल कैटरैक्ट, बाल सफेद होना, ऑस्टियोआर्थराइटिस, नी जॉइंट का पेन. सिमिलरली जब एजिंग होती है तो उसके साथ स्पाइन में भी कुछ चेंजेस होते हैं जिसको हम डिजेनरेटिव चेंजेस बोलते हैं, एंड दिस मेडिकली इज स्पॉन्डाइलोसिस और स्पॉन्डाइलाइटिस. व्हाट एग्जैक्टली इसमें क्या होता है? इट इज very very equivalent to जो हम घुटने का ऑस्टियोआर्थराइटिस बोलते हैं, that is very similar when it happens in spine, it is called spondylosis. There are certain things that happen in this. इसमें जो डिस्क होती है, जो गद्दी, जो कुशन होता है between the two bones, जो एक शॉक अब्जॉर्बर का काम करती है, they start drying. उसका जो बीच में जेली होता है, that starts to dry with age. उसकी वजह से वो enough cushioning नहीं दे पाता, तो the bones above and below start rubbing each other to form what is called growth on the bone or bony spurs. और बिकॉज उसका कुशन इफेक्ट चले जाता है, तो जो जॉइंट्स होते हैं ऊपर नीचे वो आर्थराइटिक या घिसना शुरू हो जाते हैं, एंड दिस इज व्हाट स्टार्ट्स द प्रोसेस ऑफ स्पॉन्डाइलोसिस. इसमें बहुत क्लियरली बताया गया है. इफ यू सी इन फिगर 1, देयर इज अ वर्टेब्रे, देयर इज अ डिस्क स्पेस बिलो इट, एंड उसके नीचे एक और वर्टेब्रे है. अगर आप ध्यान से देखें, अनफॉर्चुनेटली आई कांट यूज माय कर्सर हियर, बट राइट. अगर हम ध्यान से देखें तो दो वर्टेब्रे के बीच में से नस निकलती है, विच इज एग्जैक्टली अराउंड द डिस्क. और जब डिस्क खराब होना शुरू हो जाती है तो इट माइट एक्चुअली गो इन एंड प्रेस अगेंस्ट द नर्व or the spinal cord, which will give rise to the common problems of spondylosis that we commonly see in our clinical practice. So क्या होता है इसमें? when a patient suffers from spondylosis, back pain and stiffness are very common. Normally it is a aging process, hence it is seen in patients जो 50 years से ज्यादा की एज के होते हैं. However, with the current practice, बहुत सारा spondylosis has been also seen in the younger population, and for our clinical practice we divide into cervical spondylosis, thoracic spondylosis मतलब mid back का, and lower back or lumbar spondylosis. So let's see what is the difference in each of this. सर्वाइकल स्पॉन्डाइलोसिस मतलब हमें नेक पेन होता है, गर्दन का दर्द होता है उसमें. ये क्यों होता है? जो हमारे सर्वाइकल वर्टेब्रे होते हैं वो काफी कॉम्प्लेक्स रहते हैं, क्योंकि उनको हमारे पूरे स्कल को, मतलब हमारे पूरे सर को सपोर्ट करना रहता है. प्लस इसके अलावा नेक मूवमेंट सबसे ज्यादा मूवमेंट्स होती है स्पाइन में, तो जहां भी मूवमेंट ज्यादा होती है वहां पर डिजेनरेशन या घिसने के चांसेस ज्यादा रहते हैं. दैट इज व्हाई it is very susceptible to degeneration and spondylosis. Cervical spondylosis में neck pain बहुत ज्यादा common होता है, और ये पेन आप काफी हद तक अपने shoulders और अपने arms और fingers में experience कर सकते हैं. It might also give rise to what is called tingling, झंझनाहट या सुनपना या numbness in your upper limbs. Moving on to thoracic. Thoracic मतलब mid back का spondylosis is not that common. ये इसलिए इतना common नहीं है क्योंकि वहां पर बहुत ज्यादा movements नहीं होती है. In case किसी patients में ये होता है तो it normally gives rise to an upper back or what we call mid back pain and hunchback. Hunchback बहुत काफी common problem है जहां patients की back curved हो जाती है. It's not a straight back, becomes curved. This is most commonly seen in thoracic spondylosis. And finally, the most common lumbar spondylosis. This is the classical aging disorder जो patients of more than 40 years में पाया जाता है. Commonly इनमें pain और morning stiffness बहुत ज्यादा होता है. आपको अगर याद होगा तो मैंने बताया था स्टार्टिंग में कि lumbar vertebrae में there are 5 bones there. So L1, 2, 3 इतने commonly affect नहीं होते हैं. The affection starts lower down from L4, 5 and onto the first sacrum vertebrae. This is because इनमें weight bearing, अपने पूरे जो upper जो bones रहते हैं उनका सबका weight इन पर पड़ता है, and that is why they have to bear the most weight, and that is why degeneration काफी ज्यादा होता है, and commonly the patients will experience pain on activity. if I have to very classically say ये कैसे progress होता है, how does the spondylitis or spondylosis progress? I think this picture says it out. If you very closely see, सबसे पहली जो disc दिखाई है, that is the normal disc. With increased activity, जो risk factors होते हैं, which we are shortly going to discuss, the first thing that happens is हमारी जो disc का outer covering होता है, that tears off. That is called a degenerated or a torn disc. जब ये स्टेज में पेशेंट्स होता है तो बहुत सिवियर बैकएक के साथ हमारे पास आता है. इसके अलावा पेशेंट्स को और कुछ बैकएक या नेक पेन के साथ, इसके अलावा पेशेंट्स को और कुछ सिग्निफिकेंट प्रॉब्लम नहीं होता है. कई बार ऐसा होता है कि एट ये स्टेज पर पेशेंट्स घर पे ही कुछ पेन किलर्स लेते हैं, रेस्ट करते हैं, दे फील फाइन, बट एडिक्वेट ट्रीटमेंट ना हो तो दैट गोज ऑन टू द नेक्स्ट स्टेप, which is called a bulging disc. Bulging disc में क्या होता है, वो जो टॉन एरिया होता है, तो वहां पर जो अंदर का जो कुशन रहता है या जो जेली रहती है वो बाहर आ जाती है. कॉमनली वो पीछे से बाहर निकलती है, एग्जैक्टली जहां हमारा स्पाइनल कॉर्ड और नर्व्स निकलते हो रहते हैं. तो जब ये डिस्क बल्ज होना शुरू करता है, दैट इज द टाइम व्हेन द पेशेंट स्टार्ट सफरिंग सम अमाउंट ऑफ पेन. जैसे फॉर एग्जाम्पल अगर सर्वाइकल स्पाइन का डिस्क प्रॉब्लम हुआ और वहां पर से डिस्क बल्ज होना शुरू हुआ, तो दे विल स्टार्ट हैविंग पेन इन द हैंड्स, पेन इन द शोल्डर, इन द फोरआर्म. अगर लंबर स्पाइन में, अगर लोअर बैक में ये हो रहा है, तो लेग पेन, नसों का पैर में खींचना, पैर में सुनपना होना, झुनझुनी होना, ये सब शुरू हो जाता है बिकॉज ऑफ अ बल्जिंग डिस्क. अगर इसके बाद भी हमने ठीक से ध्यान नहीं दिया तो द होल डिस्क कम्स आउट, जिसको बोलते हैं हर्निएटेड डिस्क. जिसका जो अंदर का जेली जो रहता है वो पूरी तरह बाहर आ जाता है, एंड देन इट स्टार्ट्स कंप्रेसिंग द स्पाइनल कॉर्ड. और जब स्पाइनल कॉर्ड कंप्रेस होना शुरू हो जाता है, तो देन इट गिव्स राइज टू फर्दर प्रॉब्लम्स, जिसमें कई बार व्हेन इट एडवांसेस पेशेंट्स आर नॉट एबल टू स्टैंड प्रॉपर्ली, दे आर नॉट एबल टू वॉक प्रॉपर्ली, क्योंकि पैरों की ताकत पूरी तरह चली जाती है, एंड ऑल दीज प्रॉब्लम्स हैपन. फाइनली व्हाट हैपेंस इज, पूरी तरह जब डिस्क निकल जाती है तो हड्डियां सेटल हो जाती है एक के ऊपर एक, एंड दे स्टार्ट रबिंग अगेंस्ट ईच अदर, एंड हड्डियों का शेप एबनॉर्मल हो जाता है, एंड दैट इज कॉल्ड ऑस्टियोफाइट फॉर्मेशन. सो दिस इज द सीक्वेंस इन विच पेशेंट्स डेवलप स्पॉन्डाइलोसिस. फाइनली जब बैक घिसना शुरू हो जाता है, तो अलोंग विथ टिंगलिंग, नमनेस जो हमें एक्सट्रीमिटीज में एक्सपीरियंस होती है, in addition to that the patient will start having very severe back problem. So this is the sequence in which spondylosis develops. क्यों होता है, what are the common causes of spondylosis? जैसे कि हमने establish कर चुके हैं, this is an aging process, this happens with age. जो jelly रहती है वो धीरे धीरे with age starts drying, but age cannot be sort of blamed for, because there are a lot of other risk factors जिनके presence में spondylosis commonly develops. What are these risk factors? These risk factors include one, repeated strain. जैसे हम कोई काम repeatedly करते रहते हैं, for example prolonged sitting hours ऑफिस में, डेस्क जॉब, कंप्यूटर पे constantly हम रहते हैं, that is a very important risk factor. जो लोग constantly ड्राइवर्स रहते हैं, जो continuously ड्राइविंग करते रहते हैं, because दिशा जी ने rightly कहा रोड्स इतने खराब है, continuously jerks लगते रहते हैं, so that is a very common cause. Bike traveling is a very common cause. Intense work like farming, all these are very common problems. In addition, genetic also plays a very significant role. Family history का होना काफी जरूरी है. Smoking is very important. Smoking से क्या होता है, the disc dries at a very early age and gives rise to these back problems. Certain occupations, जैसे हमने बताया कि for example potters या कूली जो रहते हैं, जो सर पे भार उठा के चलते हैं, they have a very common chance of cervical spondylitis. जो heavy workers होते हैं, जो वजन उठाकर काम करते हैं, they have common back problems. Drivers, ये सारे occupations में काफी पाया जाता है. In addition, people who have sometimes mental disturbances like depression and anxiety also commonly suffer from neck pain, back pain. And lastly, injuries play a role. अगर किसी को neck injury हुई है या back injury हुई है जिसकी वजह से there has been some damage to the disc or the bones, these are the conditions in which spondylitis will be seen in younger age group as well. So what are the symptoms? Symptoms मतलब patients क्या commonly complain करते हैं in spondylitis? Aging और a degenerative process जो होता है that occurs in everyone, but ये जरूरी नहीं है कि उसके symptoms या problems हर किसी में पाए जाए. If I have to take a X-ray, किसी के spine का अगर मुझे X-ray करना है, तो most of the patients, almost up to 40% of patients might not have any problems whatsoever despite of radiological, मतलब X-ray या MRI पर कुछ problem होने के बावजूद उनको कोई problem नहीं experience होगा, and this is very very common. Some patients, however, have problems, and what are the common problems? Back pain or neck pain, this is the most common and the classical problem. However, जो ये neck pain या back pain होता है उसके दो कारण होते हैं. Initially जब डिस्क में इंजरी होती है तो इनिशियल पेन इज बिकॉज हमारे जो मसल्स होते हैं वो बहुत ज्यादा टाइट हो जाते हैं, स्पैज्म में चले जाते हैं, व्हिच इज व्हाई वी हैव द पेन. हाउएवर, जैसे जो मैंने पिक्चर बताया था जिसमें डीजेनरेशन एडवांसेस, जब बोन्स एक दूसरे को घिसना शुरू हो जाता है और आर्थराइटिस होना शुरू हो जाता है, दैट बिकम्स अ मैकेनिकल पेन जिसमें द पेन इज हैपनिंग बिकॉज ऑफ फ्रिक्शन, बिकॉज ऑफ द बोन्स रबिंग अगेंस्ट ईच अदर. दैट इज अ वेरी वेरी कॉमन प्रॉब्लम. इसके अलावा देयर माइट बी वेरी, जैसे मैंने बताया इनिशियली देयर विल बी वेरी वेरी सिवियर टाइटनेस इन द मसल्स, तो movements will be problem. Neck movements, back movements will cause a lot of problems. And lastly, the patients may have problems because of compression, tightness on the nerve or the spinal cord, जिसकी वजह से patients को झंझनाहट महसूस होती है, numbness महसूस, सुनपना महसूस होता है, depending on किस level पर वो nerve या spinal cord compress हो रहा है. In addition, अगर बहुत significantly advanced है compression, तो patients को weakness या paralysis हो सकता है. These are the very common symptoms. जब आप डॉक्टर के पास जाते हैं with the complaints, what are the signs or what are the tests that the doctor will perform? The first thing that the doctor will do is he will check your spine. आपकी spine को press करके देखेंगे कि कहाँ पर exactly आपको tenderness या pain हो रहा है. That is the first thing. Second thing that the doctor will see is आपकी movements check करेंगे. कितना stiffness है, कितनी नहीं है, आप कितना freely move कर सकते हैं. All this helps the doctor to understand कि कितना significant आपका problem है, one, and आपको किस type के medication से relief होगा. In addition, कुछ special tests होते हैं Hello. Sorry. Can you hear me now?
Hello.
Yeah. Can you hear me?
Yeah.
Yeah. So the straight leg raising test, इससे डॉक्टर को क्या पता चलता है कि आपके नस में कितना प्रेशर है. नॉर्मली अराउंड 60-70 डिग्री तक हम अपना पैर अगर ऊपर लेकर जाए तो देयर इज एब्सोल्युटली नो प्रॉब्लम. बट जो पेशेंट्स में स्लिप डिस्क होता है, जो पेशेंट्स में नर्व कंप्रेशन होता है, उनको हल्का सा भी अगर उनका पैर ऊपर उठाया जाए तो दे विल फील वेरी सिवियर पेन इन द लेग एंड दे विल नॉट बी एबल टू गो एनी फर्दर. And the next very important thing the doctor will do is assess for the power. अगर आपको लंबर स्पॉन्डाइलोसिस है तो आपके पैरों की ताकत चेक करेंगे, और अगर आपको सर्वाइकल स्पॉन्डाइलोसिस है तो आपके हाथों की ताकत चेक करेंगे. इससे हमें एक बेसिक आइडिया मिलता है कि कितना नर्व पर कंप्रेशन या स्पाइनल कॉर्ड पर कंप्रेशन है और पेशेंट को किस तरीके का ट्रीटमेंट आगे हमें देना चाहिए. So these are the important things that the doctor will check while examining the patient in the clinic. Patients कई बार आते हैं हमारे पास with back pain, MRI करा लूं डॉक्टर साहब, या neck pain है तो हम X-ray MRI करा लें. But one thing very important to understand is क्या ये हर patient में जरूरी होता है? There are two very important tests that we do to diagnose spondylosis. One is an X-ray and second is an MRI. दोनों ही टेस्ट का अपना एक इंडिविजुअल सिग्निफिकेंस होता है, one, and both of them give out very specific information. तो हमें ये जानना जरूरी है कि किस सिचुएशन में हमें क्या टेस्ट करना है. अगर पेशेंट को सिर्फ बैक एक है और बाकी कोई प्रॉब्लम नहीं है, that is the kind of patients where we would want to do an X-ray. X-ray से हमें पता चलता है कि one, डिस्क स्पेस कितना कम हुआ है, तो जो दो हड्डियों के बीच में जो गैप रहना चाहिए वो कितना कम हुआ है, और कितना बोन का घिसना शुरू हुआ है या कितना आर्थराइटिस सेट इन हुआ है. However, जो पेशेंट्स में टिंगलिंग नमनेस हो रहा है या पावर की कमी हो गई है या कोई भी न्यूरोलॉजिकल साइंस है, उनमें हमें MRI करना जरूरी होता है. MRI से हमें ये पता चलता है कि वो स्लिप डिस्क जो हुआ है वो कितना नर्व पर कंप्रेस कर रहा है, वो कितना नसों पर कंप्रेस कर रहा है, बिकॉज MRI से हमें स्पाइनल कॉर्ड और नसें बहुत क्लियरली दिखती है. एंड दीज आर द पेशेंट्स जिनमें न्यूरोलॉजिकल कंपोनेंट जैसे टिंगलिंग, नमनेस, वीकनेस या पैरालिसिस होता है, उनमें MRI करना बहुत ज्यादा जरूरी होता है. डू नॉट get into the habit of doing an MRI. बहुत बार patients खुद से MRI करके आते हैं हमारे पास just for back pain. Unfortunately, that MRI is of no use to the doctor. उससे कोई extra information या आपके treatment में benefit नहीं होगी. Only those patients who have neurological component, we need to go ahead and do an MRI. Otherwise, an X-ray of the neck or X-ray of the lower back is more than enough, and it will give us whatever information we need for the same. Right? How do we go ahead? हम इसका treatment या management कैसे करते हैं? Let me assure you, and this I am saying from literally 9 years of practice, most of the patients, literally 90 to 95% of patients with a slip disc or a back problem can be managed without any surgery with just certain simple lifestyle modifications. Surgery जैसे disc निकालना है या any further advanced surgery is needed in less than 5% of the patients. Even in those who have some amount of neurological component जैसे थोड़ा बहुत झंझनाहट होना, थोड़ा सुनपना होना, ये सारे patients में भी हम बहुत successfully we can treat them without surgery with good medical management, and most of them will recover. Only those patients who are proceeding towards paralysis जो थोड़ा सा advanced stages में आते हैं, they are the only patients who need surgery. Otherwise, most of the patients can be managed without surgery or what we call conservative treatment. So what exactly is conservative treatment? In my opinion, मेरे हिसाब से the most important conservative treatment is not even the medications, it is lifestyle changes. लाइफस्टाइल कुछ सिंपल चेंजेस करने से बहुत सिग्निफिकेंट फर्क पड़ता है बैक प्रॉब्लम्स और नेक प्रॉब्लम्स में. इन एडिशन उसको सप्लीमेंट करने के लिए फिजियोथेरेपी एंड medications are very important. Finally, the patients who do not experience improvement in symptoms with the best of conservative treatment, we should go ahead and operate on these patients. So let's look into what are the lifestyle changes. A very simple change that I would recommend to all our patients here or all our listeners here is एक simple चीज, a proper lifting technique. बहुत आम चीज रहती है, a very simple thing in our day-to-day practice. जब हम morning में नहाने जाते हैं, what we do is we fill up a bucket of water. Sometimes what we need to do is stoop down, नीचे झुक कर, आगे अपनी कमर से झुक के वो पूरी बकेट उठाकर हम कहीं साइड में रखते हैं. इससे क्या होता है, जब हम आगे झुकते हैं और कुछ भारी वजन उठाते हैं, that is the position in which our disc is the weakest. ऐसा करने पर immediately disc का जो outer covering होता है वो फट जाता है, and then all the subsequent changes of spondylosis start happening in the patient. So something as simple as, अगर आपको ऐसा कुछ करना है तो आप आपके घुटने से बैठिए नीचे, बकेट उठाइए, and then get up or keep your back straight. It is something as simple as that, goes a long way in preventing any of the back problems. Second, avoid all the possible risk factors. What are the risk factors? जैसे हमने पहले भी डिस्कस किया था, very important, prolonged sitting or prolonged desk job is a very common risk factor. So I would recommend all our listeners to make sure that after every specific 1.5-2 hours of work, they should at least get up, do some back stretching exercises, do some back bending, some movement, because of which आपके spine को थोड़ा सा movement मिले, जिसकी वजह से the joints sort of remain supple, do not go into too much of stiffness, and you do not experience back problems. Smoking should be quit if you are experiencing back pain at any given point of time. Other very important advice that I would like to give is weight reduction. And trust me, patients with back problem, if they can even achieve a 5 to 7 kilos of reduction in weight, if they are obese or if they are overweight, goes a long way. Sirf utna karne se patients come with a relief of good 70 to 75% in their back pain. So it is very important to make sure that the weight reduction is given priority while treating back problems. And like I said, some modification in the ergonomics, जैसे posture modification, अगर आप झुक के बैठते हैं, all that should be taken care of. These go a very long way in treating our back problems. Patients who have neck problems, they too should be very vigilant in terms of how they are keeping their neck, in terms of a lot of people sort of hunch their neck forward, आगे झुक के कंप्यूटर देखते हैं, काफी नजदीक से मोबाइल में काम करते हैं. All those things give rise to a very significant amount of neck pain, which should be avoided. With lifestyle modification, doctor will prescribe some amount of immobilization. कैसे? Neck, cervical collar or a lumbar belt. However, ये जानना patients को बहुत जरूरी है, and I personally also like to give this advice to all my patients. This should not be worn for prolonged periods of time. ये बहुत temporary treatment होता है. Patients जब बहुत severe pain में आते हैं तो एक जरूरी होता है कि उनको immobilize किया जाए, ताकि बहुत movement ना हो. Movement कम होने से pain automatically कम हो जाता है. बट ऐसी ट्रीटमेंट 2 या 3 हफ्ते से ज्यादा नहीं कंटिन्यू करनी चाहिए. द रीजन इज वेरी सिंपल. इमोबिलाइज करने से हमारे मसल्स वीक हो जाते हैं, और अगर मसल्स वीक हो गए तो उतना बोन्स पर प्रेशर ज्यादा आता है एंड स्पॉन्डाइलाइटिस इंक्रीज हो जाता है. सो कभी भी अगर आपको डॉक्टर प्रिस्क्राइब करते हैं कि आप गर्दन का पट्टा पहनिए या कमर का पट्टा पहनिए, मेक श्योर कि वो सिर्फ टेम्पररी प्रोविजन है एंड इट इज नॉट अ परमानेंट फॉर्म ऑफ ट्रीटमेंट. कई बार पेशेंट्स परमानेंटली वो बेल्ट पहनकर आते हैं. फाइनली फॉर एग्जांपल अगर आप अपना लोअर बैक का पट्टा पहनते हैं या लंबर बेल्ट जो बोलते हैं एलएस बेल्ट पहनते हैं, पेशेंट्स कम विद सिग्निफिकेंट बैक मसल वीकनेस, एब्डोमिनल मसल वीकनेस, और वो लोग फिर कभी भी with the kind of spondylitis they have, they never experience a significant amount of recovery. They only go downhill. So please bear in mind, do not go in for prolonged immobilization. ट्रैक्शन थेरेपी बहुत इंपॉर्टेंट होती है पेशेंट्स के लिए जब उनको सिग्निफिकेंट अक्यूट पेन होता है. जैसे पेशेंट्स आते हैं सडनली कि 2 दिन पहले मैंने कुछ भारी सामान उठाया था, अभी बहुत सिवियर बैक स्टिफनेस है, बैक पेन हो रहा है, या मैंने कुछ नेक ट्विस्ट हो गया था, या सोने में कुछ पोस्चर मेरा चेंज हो गया था जिसकी वजह से बहुत सिवियर मुझे नेक पेन हो रहा है. इन पेशेंट्स में डॉक्टर्स अपने क्लिनिक में सुपरविजन में ट्रैक्शन लगा सकते हैं. व्हाट ट्रैक्शन डज इज मसल्स को थोड़ा सा स्ट्रेच करते हैं, उसकी वजह से मसल्स रिलैक्स आउट हो जाते हैं. जो बहुत टाइटनेस आ जाती है मसल में उससे वो थोड़ा सा रिलैक्स होते हैं. प्लस हमारे जो बोन्स के जो जॉइंट होते हैं वो बिकॉज ऑफ वेरी सिवियर स्पैज्म लॉक हो जाते हैं. इट्स कॉल्ड अ लॉक्ड बैक. तो उसको रिलीव करने के लिए ट्रैक्शन थेरेपी हेल्प्स. सो ये अक्यूट केसेस में काम होता है. When patient develops a chronic या advanced spondylitis, उसमें traction therapy might not help much. Physiotherapy is very very important. Physiotherapy का importance in back problems or neck problems, I would rate it higher than even medications. So what a physiotherapist will do, it's very very simple. There are 2 things that a physiotherapist will do. एक आपका दर्द कम करने की कोशिश करेंगे और दूसरा आपके मसल स्ट्रेंथ बढ़ाने की कोशिश करेंगे. So what happens is जब भी आपके बैक प्रॉब्लम्स बहुत ज्यादा सिग्निफिकेंटली हो जाते हैं तो दैट मीन्स द बोनी पिलर वीक हो जाता है हमारा, राइट? हमारा स्पाइन वीक हो जाता है. तो जब भी कोई चीज अगर वीक हो जाती है, फॉर एग्जाम्पल इफ अ पेशेंट हैज वन किडनी दैट इज वीकर, तो दूसरी किडनी उसका काम अपने आप इट सॉर्ट ऑफ टेक्स ओवर, राइट, टू मेक श्योर दैट द बॉडी कंटिन्यूज एज नॉर्मल. दिस इज अ वेरी कॉमन सिमिलर थिंग दैट वी आर डूइंग हियर. अगर स्पाइन वीक हो चुकी है बिकॉज ऑफ स्पॉन्डाइलाइटिस, तो बैक मसल्स, एब्डोमिनल मसल्स, कोर मसल्स की ताकत बढ़ाए तो स्पाइन हमारी जो है वो ऑफलोड हो जाएगी, उसका काम थोड़ा सा कम हो जाएगा एंड पेशेंट्स को सिग्निफिकेंट benefit in terms of pain मिल सकता है. So that is the idea behind doing very intense physiotherapy in patients with back and neck problem. So when you visit a physiotherapist, initially the physiotherapist will start with some hot and cold treatment to relieve pain. They can also give you some electrical stimulus and deep tissue massages. The idea is to relieve the muscle spasm and improve the flexibility of your spine. Following this, जैसे मैंने बताया, exercises are very important. You will have the physiotherapist will ask you to do specific neck and back physiotherapy. The idea being very very simple. उससे strength, muscle strength बढ़ेगा and the spine will be offloaded. Coming to the medical treatment. Medical treatment is possible for all the symptoms. बट ये याद रखना जरूरी है कि जो एज रिलेटेड चेंजेस ऑलरेडी हो चुके हैं उसको रिवर्स नहीं किया जा सकता. Medicines will only relieve you of your symptoms, and that is why I put medical management behind physiotherapy. What are the medicines that the doctors will give you? They can give you painkillers, they can give you anti-inflammatories to reduce the swelling in the back. They will be giving you muscle relaxants to relieve the tightness of the muscle. And finally, they will give you certain kinds of neuromodulators. For it, this is very important. जो patients में tingling numbness होती है, so there is a medicine which reduces this tingling numbness. That's called a neuromodulator. And multivitamin, especially B complex, क्योंकि B complex helps in healing of the nerves. So these are the medications that are very very important. neuromodulators and multivitamins can be given and is normally given to the patient for a prolonged period because they are relatively lack of any side effects. However, painkillers, anti-inflammatories and muscle relaxants can only be given for a very limited period of time because of their specific side effects. With all these things, lifestyle modification, your physiotherapy, medical management, with best of these treatments, some unfortunate patients do not still recover completely. They have far advanced neurological complaints, and these are the patients where we go ahead with surgical management. But like I initially said, surgical management ये reserved रखते हैं सिर्फ 2 to 5% of all the patients with back and neck problems that we see. Surgical management mein basically there are 3 things that the doctors will do. One, if it is only your tingling, numbness and hand and leg pain that you experience, not a very significant pain, and on the MRI the doctor finds that there is a single disc which is migrated behind and is affecting your nerve, then they will go ahead and simply remove that disc. If the patient feels that it's not just the disc, but the whole canal has become too tight, the whole passage of the spinal cord has become too tight, then they would remove the bone, the roof of the vertebrae, they would remove to give some space to the spinal cord. However, remember that these kind of treatments will not take care of the back problem, because the back problem is happening because of the arthritic bones. Here with these kind of treatments, disc removal, what the doctor is doing is just taking off the pressure from the nerves to relieve what is called the radicular pain or the nerve related pain, and not taking care of the back pain. So this is a very common problem. Patients come to us, we do a disc removal, but the patients keep coming to us with back problem. Please remember, disc removal is not the solution to your back problem. So if the doctor has advised you disc removal, it is only because you have neurological problems and nothing else. Finally, if the doctor feels that there is one particular level which is very significantly arthritic, and that is the cause of your back or neck problem along with your neurological complaints, then the doctor might remove the disc and advocate fusing. मतलब वो दो लेवल को ज्वाइन करें ताकि there is no movement at that level, the bones do not rub against each other, and you will have a significant relief in your back or neck pain. So this is what an overview of the surgical management is like. And with this, I hope with a concise talk that we were able to go through some of the important protocols in treatment and understanding this condition, and maybe solve some mysteries and myths around this very common orthopedic problem. Thank you very much.
Thank you, Dr. Jadia. It was a very, very informative talk, and a lot of things which were myths actually have been cleared right now, especially like what you said, that MRI is not always needed for any of the back pains. Like people just go blindly for it, and there are people, especially the lower socio-economic class, they would always feel कि if there is a back pain, सब doctors MRI के लिए भेज देंगे, उससे अच्छा जाना ही नहीं है. That is the best thing to do, and they avoid going to the doctors because they feel कि ये बहुत बड़ा खर्चा होने वाला है.
True.
So again, from that, and the second thing being the collars and the lumbar sacral belts that you are saying, which is not always to be worn for a very long time. And that is one of the reasons when people have this cervical pain, especially, they don't want to wear those, looking at that weird look that they will get, that they try to avoid. It's better not to go and get it checked only. So those things were some things which I felt from personally my side that which were of more importance, that and looking at that, I would say things should not be avoided or just ignored for the sake of it. We don't want it, and so we are not going to the doctor.
Absolutely.
It is.
There are a lot of mysteries surrounding back problems. There still are a lot of mysteries. But things are very very simple. Keep it simple. जैसे मैंने बताया, आपको क्या symptom है, based on what symptom you have, it is not necessary. A lot of times these patients come to me and say that मेरे neighbor को back problem था, उनको ये treatment कराया, उनको ठीक हो गया. But what is important is you might not be having the same thing that the other person is having. The idea is to understand what the problem is, to understand the logic behind a particular treatment. बहुत बार क्या होता है, हमारे common myths रहते हैं, plus because doctors are sometimes overworked, they may not be able to give you all the information in the OPD. That is why self-awareness becomes very important. The idea of incorporating all this was to also आपको एक समझ में आए कि in which situation, if your medical whoever your doctor is prescribing a particular kind of treatment, what is the logic behind that treatment? Understanding that, unfortunately, spine problems are such that in orthopedics we say that no matter what you do, a best spine treatment can make a very unhappy patient less unhappy, but it will never make a patient very very happy. That is the most unfortunate part about the spine problems, and that is why self-awareness and good counseling as far as spinal problems are concerned is very very important in my perspective.
We would like people to put up their questions, and if they don't want to type in, they can raise their hands so that we can let them unmute and put up their questions. By that time, I'll put up some questions. Doctor, what are the important do's and don'ts that should be especially taken care for any of these? As such, you have elaborated a lot of things, but something like pinpoint for cervical or lumbar, which has to be like, it is an absolute no or an absolute yes that has to be done.
In terms of prevention or for patients who are already suffering from
you can tell us both, like, if we want to prevent.
In terms of prevention, I think it's, in my opinion, what is very important is a healthy lifestyle. A healthy lifestyle is, what happens is, with our very very fast life, we are not able to give enough time to body stretching, to exercises. Sedentary lifestyle and all these things are very important in causing back problems. Patients who are, or rather people who are too much into what we say yoga, the asanas that we do from the beginning, not once the spondylitis has been established, but with a healthy spine, people who are into maintaining good flexibility of the spine, they are found to somehow have a very very low incidence of all these degenerative spine conditions. The idea is our joints need movement, because that is the nutrition for our joints. If you stop movement, the joints will degenerate. So that is the idea. That is why movements or keeping the spine supple and flexible is very very important. One, addiction in terms of smoking is an absolute no. It has been seen to probably increase the degeneration of spine to almost more than twice as compared to what the normal population will experience. And maintaining a healthy weight, these are very very important things, I think, for common people to avoid back problems. As far as people who have already developed back problems, my advice to them would be, one, make sure that you do undertake your lifestyle modifications. These are the patients, especially patients with neck problems. They should avoid any kind of heavy weight lifting on the neck, any kind of rigorous neck activities. People with back problems, very important to reduce the kind of heavy weight lifting or forward bending. These are very very important. In addition, I would say, after adequate pain relief, doing good physiotherapy will help almost 90 to 95% patients.
There is a question from someone. They say he has a central herniation at the L5S1 root.
Right.
It's about at the S1 nerve root. What should I do?
See, if you have a central herniation at a particular level, अगर आपको central herniation है, that is an MRI finding. As a clinician, I never go by the MRI finding. That for me comes second. What is very important is आपको problems क्या हो रहे हैं. आपको सिर्फ बैक हो रहा है, तो जैसे मैंने बताया, you do not need to do anything. You only have to go ahead with some amount of medication, some amount of rest for some time. Backache आपका थोड़ा सा relief हो जाए, then you can go ahead with physiotherapy, back and your core muscles. Once that happens, your disc, 90% of the discs resolve on their own. We do not need to do anything. इसके बावजूद अगर आपको tingling numbness है, if you are saying L5 S1 level, means आपको पैर के अंगूठे, पैर की उंगलियों के आसपास tingling numbness होगा, because that is the area which is supplied by the S1 nerve root, the outer margins of the feet. That is where अगर आपको ये तकलीफ हो रही है, some amount of झंझनाहट and all that, then you can take those neuromodulator medicines which we have discussed. That a period of 1.5-2 months with physiotherapy and lifestyle modification should help you. If that still doesn't help you, then maybe we should be thinking about disc removal. But again, the chances are very, very little that you might have to go there if you do not have any of the above symptoms in a significant severity.
Hello.
Sorry.
Sir.
Yes.
सर मेरी मिसेस को L4 L5 के बीच में गैप हो गया है, और तो इनर डायमीटर इज ओनली 5 मिलीमीटर. डॉक्टर अहमदाबाद के कंसल्टेंट डॉक्टर उन्होंने सजेस्ट किया है, एक तो 2 है टैबलेट, गवाच एम और दूसरा लेनोल ER.
सॉरी, आई डिडंट अंडरस्टैंड. डॉक्टर ने क्या सजेस्ट किया है?
डॉक्टर सजेस्ट किया है लाइफस्टाइल, तो आपने बोला ऐसा तो बोला ही है, लाइफस्टाइल इंप्रूव करो और फिजियोथेरेपी करो, वो सब तो बोला है, लेकिन ये 2 गोली दिया है, गवाच एम डेली लेने का और लेनोल ER वो भी देखिए. दोनों पेन किलर है सबके क्या है?
So Lanol ER basically is a paracetamol based painkiller. The reason why उन्होंने ये आपको दवा दी है because उसके side effects काफी कम रहते हैं. आपने जो दूसरी दवा बोली, that is the neuromodulator medicine, उसमें विटामिन B12 और गाबापिन रहता है. गाबापिन बेसिकली अपने नर्व का स्पेशल विटामिन रहता है जो नर्व हीलिंग को काम करता है, एंड B12 is also helps in regeneration of the nerve. इसलिए उन्होंने आपको ये मेडिकेशंस दी है. इससे फर्क
पड़ेगा. दोनों टैबलेट लॉन्ग टाइम लेकर चलेगा, 2 साल से लगते ही हम लोग.
जैसे मैंने बताया, these medications can be taken for a longer time. इसके कुछ significant side effects नहीं रहते हैं.
और उन्होंने बोला था सर्जरी को, लेकिन सर्जरी का हम लोग को डर लगता है, तो सर्जरी करना चाहिए कि नहीं कराना चाहिए?
सर, सर्जरी कराना चाहिए कि नहीं कराना चाहिए विल डिपेंड ऑन आपके वाइफ को क्या सिम्टम्स है. अगर उनके पैर वो चल नहीं पाते लंबे डिस्टेंस तक, जैसे थोड़े डिस्टेंस तक चल के उनके पैर हेवी हो जाते हैं या पैर आगे चल नहीं पा रहे हैं, ऐसे सब सिम्टम्स है, ओनली देन वुड आई से मे बी सर्जरी विल हेल्प. वो भी आफ्टर 1-2 महीना ऑफ कंजर्वेटिव ट्रीटमेंट. बट अगर उनको ऐसे कुछ सिम्टम्स नहीं है, तो जस्ट बैक पेन है और कुछ ज्यादा सिग्निफिकेंट प्रॉब्लम नहीं है, तो देन सर्जरी माइट नॉट.
नहीं, लेकिन झंझनाहट कभी-कभी होती है, कभी-कभी लॉन्ग डिस्टेंस चलने में बैठ जाना पड़ता है, झंझनाहट कभी-कभी होती है.
1-आध महीना हम ये ट्रीटमेंट करके देख सकते हैं. अगर उनको फर्क नहीं पड़ रहा है, और जैसे आप बोल रहे हैं कि अभी फॉर एग्जांपल 15 मिनट चल के उनको रुकना पड़ रहा है, आगे चल के उनको 10 मिनट चलने के बाद रुकना पड़े, जैसे वो वॉकिंग डिस्टेंस अगर कम होते जा रहा है, तो दैट मींस आपकी ट्रीटमेंट काम नहीं कर रही है आपकी केस में. मे बी अदर ऑप्शंस माइट बी सूटेबल.
अच्छा, तो सब आपका कांटेक्ट करने का है तो कैसे कर सकते हैं?
यू कैन विजिट.
आप अंकल, आप वो ग्रुप में हो क्या, मेडिकल वाला?
नहीं, ग्रुप में नहीं हो.
हाँ, तो आप उसमें ऐड हो जाइए, मैं उसमें सब अपलोड कर दूंगी, जो भी उनका डिटेल्स है वो सब.
अच्छा, तो उसमें ऐड कर. आपको जो व्हाट्सएप नंबर कुछ है ऐसा कुछ?
आप कैसे इसमें कैसे ज्वाइन हुए? आप जो लिंक पे ज्वाइन हुए, कैसे ज्वाइन हुए थे?
लिंक में हमारा एक फ्रेंड है और उसकी डॉटर एकता शाह, डॉक्टर एकता
हाँ
शाह है।
हाँ, तो डॉक्टर एकता शाह से बात कर लीजिएगा, उनसे
ओके
मेरा नंबर और सब कुछ मिल जाएगा।
ओके 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 मैडम, थैंक यू थैंक यू थैंक यू
ओके।
डॉक्टर साहब, थैंक यू।
No problem.
And doctor, if there is a B12 deficiency, as which is seen in a lot of people nowadays, does that cause anywhere? I mean, is there anywhere a link with
B
spondylosis?
deficiency will give rise to some of the symptoms. For example, these patients will have tingling numbness in the hands or the legs, like we see. However, there is a difference in what happens in B12 deficiency as compared to what happens in spine-related problems. जैसे मैंने वो टेस्ट बताया था, जो स्ट्रेट लेग रेजिंग टेस्ट, उनमें कभी भी ये पेशेंट्स B12 डेफिशिएंसी में पॉजिटिव नहीं होगा. They will never have any back related issues, उनमें back pain as such नहीं होगा. Neither will they have the very significant neurological involvement. उनमें सिर्फ tingling numbness normally पाया जाता है, even if the B12 is very very significantly low. उसमें if we have
Sorry.
if we have to go into more details, B12 deficiency से हमारे blood में भी कुछ changes पाए जाते हैं. For example, patients will have what is called a very increased size of RBC, which can be easily picked up on our routine CBC scan. So that these are the ways in which we can differentiate between tingling numbness that is caused by B12 deficiency versus tingling numbness that is caused by a spinal problem.
What about the vertigo which happens due to cervical spine?
क्या होता है सर्वाइकल, जब whenever there is cervical spondylitis, जैसे मैंने आपको स्टार्टिंग में बताया था, every nerve has a specific function. However, body is made in which there is some amount of overlap between all these nerve mapping जो बोलते हैं, हर nerve का एक map रहता है जहां पर वो supply करती है, तो there is a significant amount of overlap. वैसे जो हमारे cervical nerves होते हैं, they are very closely associated with the nerves which are related to the proprioception, rather वो जो vertigo related जो nerves रहती है उससे बहुत closely connected रहती है. इसलिए a lot of these patients with cervical spondylitis do have vertigo like symptoms. However, it is more like, for example, if I have to for the advantage of common people, if I have to say, अगर आपको दांत का दर्द है, तो you'll also find pain in your ear, find pain in the neck, sometimes pain in the shoulder. This is called radiating pain. The origin is in the teeth. However, your ear might also pain. So this is very similar because ये बहुत closely associated है, the vertigo center and the cervical spine. That is why patients with cervical spondylitis sometimes have vertigo issues. In such cases, most of these patients benefit with temporary immobilization of the cervical spine. This is cervical collar पहनना, not to do isolated neck movements. जैसे for example, I ask these patients, अगर आपको एक side पर turn होना है, तो make sure your whole body turns rather than your neck turning, in addition to wearing the cervical spine. And we can give certain anti-vertigo medications to these patients. Most of these patients benefit in around 2 weeks time, the vertigo settles down, and then we can go ahead with the routine management of the cervical spondylitis.
Even for back pain, they used to say that you should not get up like straight up and you should always turn on any
Turn
one
to
of the
the
sides.
The idea is immobilization. Because आपके bones rub हो रहे हैं, आपको pain हो रहा है, we do not want that to happen.
Oh.
That is the idea why the doctors say such things.
Any specific food items to be eaten or some diet things to be taken care for such?
Honestly, there is no association of food with any of the back related problems. In my advice, it's simple to avoid food that will give rise to obesity, that will cause weight gain, because we don't want that to happen. That will add on to the pressure. But in otherwise, with our modern medicine, I don't think food has a very significant role to play with in patients with spondylitis?
As you said, like the first stage of any of these spondylosis is the degenerative, the tear, which happens in the disc. If by that time we come to, I mean, whatever the pain or whatever the small symptoms we come to know,
Right.
and if we take care, would that again heal back and get to the normal disc, or the degeneration has already happened, so it will just avoid the further progression?
What happens is, when you're doing that, when you're at that stage, that is the stage when your muscles will go into spasm. So that is the time when you will have only a neck pain or a back pain with very tight back or tight neck. At that level, if you come, the doctor will invariably put you on rest and muscle relaxant medications and nothing else. After which you will be asked to do physiotherapy to strengthen the area once the pain subsides. So what happens is, body has a tremendous capacity to heal. So what happens is, yes, in that much time, if there is just a tear in the disc and if the healthcare practitioner is approached with good rest, that will heal. The disc will not come out, and with physiotherapy you will strengthen your muscles, so there will not be excess pressure. A word of caution is, always remember, healing is always by scar tissue. Just say, for example, if you have a wound on the skin, normal skin will not come back, it will be a scar skin that will come, right? So it is always by scar tissue, and the scar is invariably weaker than the original tissue. That is why physiotherapy, even at that point of time, becomes very important, so that you strengthen the muscles, so that there is not too much weight or pressure coming on that disc, so that it does not further tear, or that heal repairs like a healed area and does not weaken further. Yes.
Even with the bulge, which normal herniated or the small bulge which comes up, would that go back or would that remain?
Yes. If it is a contained bulge where it is not herniated doesn't go back. If it is a contained bulge, the stage 2 that we had seen, where the disc was just bulging out, with good physiotherapy and traction therapy, the bulge tends to go back. Yes.
And as you said that if it is like the spinal cord has become quite tight because of the herniation, and with surgery we just remove the pressure, so that nothing else has been done, but only the pressure has to be removed, but it will not take care of the back pain per se. So after that, once, even if that surgery is done, is it necessary to continue with the conservative treatment, or is it all that?
Yes, physiotherapy.
Only physiotherapy.
See, what happens is, if the surgeon is only removing a small piece of the disc, then in those cases they don't remove the entire disc. They remove only the piece of the disc which has come out and which is pressing against the nerve. In those cases, there is already a rent in the disc, and that is why that is a weak area, and that is why we need to offload the spine, and hence physiotherapy even after disc removal becomes important. But the purpose is different. The disc removal has been done to remove the pressure from the nerve, so that those tingling, numbness and radicular pain goes away. However, the back is still weak, and we need to strengthen that with physiotherapy. Yes.
And what about like if you have removed the whole disc and there is a fusion of the bones, as per what you said, would there be a problem with the bending?
If the disc has been removed and the whole disc needs to be removed, then you need to fuse the bones. The reason why I'm saying is, if the whole disc is removed, there is always a gap between the two bones, which is occupied by the disc. Now, when you have removed the disc, the bones will settle on one another, because there is no space, the space there is empty, so it will settle. When it settles, the dynamics of the joint behind changes, and it puts a lot of pressure on those small joints, and then these patients will have a lot of back problems. Hence, if you're removing the whole disc, it is always better to put in a small cage, which is a spacer in between, which occupies that space of the disc, and fuse it with the bone. Yes, though the movement between those two bones will be lost, but functionally the patient does not see much of a difference, because the movement occurs at almost 5 to 6 levels, and only one level of the 5 to 6 levels that you have fused will not amount to too much of a functional loss.
And especially with people with osteoarthritis or with knee pain, and if they have this back pain too, because it is a degenerative change.
Right.
And as you said, if they want to carry a heavy bucket or something, you have to bend down at the knees and carry it. But it's not possible.
Yes, so that becomes a problem when you have a knee arthritis plus, then bending down becomes very, very difficult. In those cases, well, what you need to do is, one, you'll have to stop lifting heavy weight, because lifting heavy weight is detrimental both to your back and the knees. Unfortunately, with those patients, these are normally, when we are talking about an advanced arthritis of both the knee and the back, we are talking about very, very elderly patients. And yes, I would advise no weightlifting for such patients at all.
I think any more questions anyone has, then you can put it up right away. I think that's it, Doctor. We had a lot of good information from you, and a lot of myths and mysteries have been solved, and a lot of better knowledge related to cervical and lumbar, which was just taken for granted. I mean, people just avoid thinking that it is something which is just to be ignored, rather, I would say.
Earlier to you visit your doctor, it's okay. I mean, in my practice, I believe this. It's okay to raise a false alarm in front of a doctor rather than, coming at a very, very late stage where even our hands are tied, where we can't do much about it, because these are irreversible changes. And when they go beyond a certain level, there is unfortunately not much that we can do for the patients. So it's better to be early.
There is one more question from someone. I'll just tell him. Yeah, Mayur bhai, you can.
Yeah, sir. Yeah, sir. Namaste. मैं मयूर जैन. एज मेरा 35 years है. मुझे ये सर लास्ट 3 years से है ना, मुझे L5S1 मेरा जो ये MRI का रिपोर्ट था, L5S1 causes mild canal stenosis and Abbott's left S1 nerve root. तो मैं ये 4 years से सर मेरा ट्रीटमेंट चालू है. मैं मल्टीपल डॉक्टर्स के पास गया हूँ, जैसे डॉक्टर हेतल चीनी वाला है, ही इज इन मलाड लिंक रोड, और डॉक्टर पूजा मेहता फिजियोथेरेपिस्ट है. मैंने फिजियोथेरेपी भी करवाई है 2-3 जगह से, बट मुझे अभी तक मतलब फिक्स रिलीफ नहीं हुआ है. मुझे अभी भी 25% पेन है. मैं ज्यादा वॉक कर लेता हूँ तो मुझे राइट साइड में एकदम बैक में नीचे राइट साइड में मुझे पेन होता है.
राइट. So जैसे कि आपने बताया आपके symptoms, you read your MRI. This is I am really glad मयूर भाई आपने ये मुझे question पूछा है. This will benefit a lot of our audience. One thing you said is your MRI is showing a mild canal stenosis at L5S1 level.
Yes, sir.
This is one aspect of your problem. The second thing you said is आपको back pain हो रहा है. Now I understand that this back pain has got to do nothing with your canal stenosis. Your MRI finding and your back issues are totally different. आपको जो back pain हो रहा है, that back pain might be related to the changes in the joints of the spine that have happened because of your disc problem.
Okay.
But that MRI has got no role in your case. What you will have to do is you will have to go ahead with lifestyle modifications. आपको जैसे आपने बताया 75% आपको relief हुआ है. That is exactly what I said. Unfortunately, spine is such a disease where we can make a patient from extremely unhappy to unhappy completely, or sometimes is not possible. In your case, what my observation would be with whatever little information I have is there must be some amount of arthritis at the L5S1 level.
Okay.
It's causing your back pain on prolonged walking, because with every step that you take, there is some amount of loading of the spine that takes place. और वो loading से आपके joints पर pressure पड़ रहा है, and they are rubbing, and after prolonged rubbing, you are experiencing some amount of back pain.
Right, sir.
If you had a purely canal stenosis abutting your nerve root, or rather increasing the pressure, आपको लंबे समय तक चलने के बाद आपको बैक पेन नहीं होता, आपके पैरों में दर्द होता और आपका पैर आगे नहीं बढ़ पाता. So that means your problem is not neurological, your problem is a mechanical back pain जिसमें आपके joints arthritic होने की वजह से आपको ये pain हो रहा है. To be honest, a sure shot treatment in your case would be fusion of L5S1 जिसकी वजह से आपको complete pain relief हो जाए. But I would not advocate that treatment. My first line treatment for you would be if you can reduce some amount of your weight. If you feel you are a little on the heavier side, then that will offload your spine. Continue your physiotherapy and lifestyle modifications is something that I would still advocate despite of all these treatments, because surgery might not be the best result for you at this point of time. Yes.
Okay, sir. Okay. Thank you, sir. Thanks, sir.
No problem.
So I think so. We would like to end the session with this. I don't have any more questions coming up. So thank you very much, Dr. Chintan Jadia. So this is the best I could do for everyone, and I found it very helpful, even for myself, to make my patients understand more about cervical and lumbar spondylosis. And
I am glad I could contribute in some way.
Yeah, thank you. Thanks a lot.
No problem.
And I would like your details to be put up so that whoever wants to consult you can
Sure.
get in touch with you.
Sure, sure.
So we'll put up his details on the group, and you all can get in touch with him for whatever, if you want it necessary. Yeah.
Thank you very much.
Thank you very much. Thank you, doctor.